Welcome to the Long-Term Care Chronicles podcast.
Hello, I'm Helena Nielsen, and I'm going to be speaking to Miranda Ferrier, who is the National President of the Ontario PSW Association and the Canadian Support Workers Association. Today we're going to be talking about PSW staffing and training. And I have the distinct pleasure of having you, Miranda Ferrier, speaking with us today. Miranda, you are the National President of the Ontario PSW Association and the Canadian for the Canadian Support Workers Association. Quite a title, and so I'm very, very pleased that you can join us today. Why don't we start, Miranda? I've got about 11 questions, and I'm hoping that we can get through them today. But perhaps allow me to first let you introduce yourself personally, and then we can start with some of the questions.
Sure. My name is Miranda Ferrier. I'm the National President of the Canadian Support Workers Association and the Ontario Personal Support Workers Association. I am also a personal support worker, having worked in long-term care for 8 years, home care and hospital settings for the remainder of the time that I've been a PSW. And I'm super humbled and proud to represent the PSWs across our nation.
Thank you so much, and we're certainly very pleased that you found the time to speak to us today. I'd like to get started. I have about 11 questions, and I'm hoping that we can get through those questions because I know that they're going to be very important to all of us at the end. Prior to COVID-19, staffing levels were far from adequate for personal support workers, and the pandemic has made that painfully obvious. First question. What would be the most ideal staffing situation in long-term care to provide the compassionate and quality care we all expect?
I think that's a great question right off the hop. This is a topic that we've all been discussing for so long. I know myself and the association, we have been demanding a set ratio in long-term care facilities, being, the amount of residents that one personal support worker can care for. We are asking for a 1 to 8, so one personal support worker to 8 residents. I know that's not exactly where we want to be, but we can actually decrease it as time goes on, but we need to start somewhere. I also think as well that we need to take into account that the personal support worker has not been a big part of the healthcare team overall in long-term care, which has always baffled us because PSWs are the ones that provide the most intimate of care, most personal of care for those in our long-term care facilities. So by involving them as a part of the interdisciplinary healthcare team in long-term care, where they're involved in family conversations, where they can interact on a more official level with families and answer their questions, I think that would be very helpful.
I think you'll have a lot of people agreeing with you. It's a start, but hopefully we can all see that number being reduced down the road.
Absolutely.
The next thing is it's a given that the lockout of family members has had a direct impact on the PSWs. The question is, what kind of feedback have you been hearing from your membership in this regard?
They miss having the families there. Many times the families are able to provide that extra special care that no matter how much the personal support worker wants to be able to provide that for the residents, they just can't, because of the lack of staff and the lack of time, frankly. Mm-hmm. I think they've also seen, and we've heard this a lot from our membership through the pandemic, they've seen the decline of a lot of residents because they haven't had their loved ones there with them. It was a very sad time, and still is a sad time for a lot of personal support workers when they watch their residents, because they really do care. I think bringing families back in order to help provide that care to their loved ones in long-term care, and again, kind of same scenario, right? Keeping the PSW involved, same with keeping the family more involved. This needs to be a more community-based care as opposed to what it is right now.
No, I quite agree. I had my mother in a home for 5 years, and I was there practically every day, and I know the kind of work that is done by the PSWs, and we do help. We do try to assist in providing them with a little bit more time with other loved ones, and so we have to work together. That's very obvious. Currently, the PSWs are not regulated health professionals. And of course, as such, training and wages vary across the country. The question is, as part of the possible solution, would you recommend regulating your profession and setting standards on training and wages nationally?
Oh, that would be a dream if we could do that. Honestly, we at the association in Ontario, we have actually been fighting and lobbying and advocating for regulation of the personal support workers going on 5 years now. We have a whole system that we've built ourselves through the association. We've developed a separate college that would deal with complaints or disciplinary action. We've offered to do it for free. So we've gone to the government. We've said, listen, we already have a system as the professional association to do background checks, to ensure that their education is correct, we give them a mandatory $1 million professional liability insurance. We hold them accountable. So let us do it for free. We already represent 42,000 personal support workers in Ontario with over 69,000 across Canada. I think that if we start in Ontario and trickle out, that'd be great. And then to speak to what you're saying about national standards, it's training of the personal support workers. That again, a dream. We want that super bad. In every province, we're called something different. It's a very confusing, profession to be in. And then you have some provinces that don't accept people from other provinces with the same credentials because they're called something different. It's quite a ridiculous state.
I understand too, Miranda, that in different provinces they have different education requirements. Some as little as 6 months training, and others go up to 2 years. And I think that's very important what you're saying, that we need to have some national standards. And I think your family councils will agree with you. The next thing is, through observation, many family members feel that not enough training goes into geriatric care, and I certainly came across that in my experience as having a loved one in long-term care. How do you care to comment on that?
I agree with you. I don't think that the personal support worker program here in the province of Ontario is in depth enough on geriatrics. I like to actually call the PSW program the novice program. And the reason why I like to call it that is because we are currently working with different community colleges across Ontario, and we have our own educational department that are specializing PSWs. We want to see PSWs go and specialize in areas that they want to be specialized in. For example, geriatrics, another one, autism, Parkinson's. There's so many specializations that PSWs can do. The PSW program in itself, the curriculum, I took it and I graduated in 2006 as a PSW. I was part of an 8-month program. And it wasn't enough. I'll be honest, it really was not enough. So yes, I agree. They need more training.
Understood. Family members, I think you can appreciate, are very sensitive to the concerns of the personal support workers and that they've been experiencing during this pandemic on a personal basis, particularly. What is your membership saying in regards to the challenges being faced during COVID-19? For example, being the only breadwinner, the pandemic pay, and coping with the slow deterioration of some residents that they care for. What would you say to that?
It's been hell. I'll be honest. Our PSWs, especially in the beginning of this pandemic, it was a nightmare. In some places, unfortunately, continues to be a nightmare. They're doing their best. We have PSWs in long-term care. They all received the $4 increase in long-term care facilities, but then, PSWs working in home care did not receive it in certain areas.
Mm-hmm.
There has been mass confusion surrounding the pandemic pay. But then there's also been confusion surrounding, what's next. Are we actually going to see these recommendations from the staffing study go forward? They want answers. And this is a new thing for us as PSWs typically are not, or in the past have never been mightily vocal. But since the pandemic hit, we're finding that there is this new passion and this new drive for change within the PSW field. So I think we're going to start seeing some massive changes coming down the pipeline. I do know that they are all for what is best for their residents in those homes, and they advocate like crazy for them. We get phone calls every day about situations and how they can handle it and how they can, better get the word out to the family or go to management, etc., and what to do. So I think the PSWs have stepped up, and I think we're going to see change.
Good to hear. Now, with respect to the pandemic pay, are there still some waiting to be paid for what the government has promised? Are you hearing that from your members?
Oh, yeah, absolutely we are. We're hearing it right now, hourly on the hour. We're hearing it from them because rightfully so, they're frustrated.
Yeah.
The money was announced way too early. Let's just be honest. It was a great announcement and it needed to happen at that time in order to boost morale. I completely understand why the government did that. But they didn't explain it properly, and they also didn't dull it out properly. So so companies, what they were doing, a lot of companies, is they didn't receive the money from the federal government until the end of July. So a lot of our personal support workers are now getting it on their paychecks in lump sums, but they've been anxiously awaiting it for months. So there's been a lot of frustration surrounding this.
Of course. Understandable. Well, what have you heard from your membership in regards to support from their employers? And is there a difference between for-profit, non-for-profit, and municipal facilities with respect to wages and benefit differences? I mean, have you heard from them in terms of the kind of support that they're getting and in those particular types of homes?
I typically try not to answer that question. I'm just going to be honest. I work with for-profit. I work with not-for-profit, and I work with municipal homes. We support PSWs everywhere, but I will answer the question. The for-profits actually pay pretty well, but the problem is there's no full-time lines, and they don't offer benefits to part-timers. Then you go into the not-for-profit where the pay is a little bit less than the for-profits we find, and they typically get maybe half of their benefits paid or no benefits at all, and there's no full-time lines. In the municipalities, we actually see the PSWs being paid the most in the municipal homes. Typically, I know that like in Chatham, there's one of the homes there, which is a municipal home, and our PSWs are making $26 an hour with full benefits. But of course, they're also full-timers, right? So it's so vague across the board because I could be saying this about the for-profit and then tomorrow it could switch. You never know.
I think we've been hearing a lot about how important it is to be able to give the PSWs a decent wage so that they can have a full-time job in one facility and not have to go from one to another in order to make a decent living, because that's how some of the infections have spread. Never mind the pandemic, but that's how the infections have spread periodically throughout our homes. I know that we've encountered a few times where we've not been able to have meetings in the building because of one floor having a breakout. And I think all of that stems from the fact that some have had to go from home to home in order to have enough hours to make ends meet. And I think that's another thing that we need to look at, is to make sure that the salary does give them a decent living. So hopefully that's going to be next on the agenda as well. Moving on, I'm sure that your membership has reached out to you with concerns over the years. The question is, has there been some common threads of concern expressed both from both before COVID-19 and during? So obviously there will be some differences between before and after, but are there some common threads as a result of the PSWs in both situations? Have you found any?
You know what's interesting about that question is there really hasn't been a change. The issues that we faced prior to the pandemic versus the issues that we faced through the pandemic and ongoing hasn't changed. We still don't have the staff. The PSWs still don't have that professional respect, right? AKA regulation. We're finding that PSWs are still burnt out. They're leaving the field in droves. It's all the same problems that we had prior to the pandemic have only been, amplified
Exasperated,
in the
yeah.
pandemic.
Mm-hmm. Mm-hmm. Oh, that's interesting. That's interesting. I would have thought that there might have been a few more. The fact that because of the pandemic, they weren't able to go to various homes and therefore haven't been able to augment their salary. I realize that the government was, assisting in some way, but I would have thought that that would have been one of the differences. But a common thread, of course, I think we can all appreciate is the staffing level, plain and simple, the staffing level, and the and also their
absolutely
and also their, I think, credentials and how they're seen by the powers to be in terms of their contribution to long-term care. I think you're right, it has to change, and that is a common thread, I'm pretty sure. Yeah. Now, in Ontario, the Registered Nurses Association of Ontario indicated the July 31st, 2020 deadline for the basic care guarantee. Question is, do you agree with what they are indicating, and what are other provinces saying in regards to PSW ratios for care?
I am very much familiar with the RNAO ask. I agree that there should be more nurses in long-term care homes, but I do not agree with decreasing the personal support workers and putting in more nurses. I think that we'd be going backwards if we did that. Now, for other provinces, I know that the staffing issues are the same, literally across Canada. I currently have chapters in Saskatchewan, Manitoba, British Columbia, starting one in Alberta, and we have Newfoundland. And it's the same issue. They're all working short. They're not being supplied what they need in order to do their jobs accordingly. It's really concerning when you're hearing the same issues from your, colleagues from across our nation, and that we haven't figured out that we need to change that.
Mm-hmm. Mm-hmm. I tend to agree with you in terms of what they're suggesting is that in fact there be less time, it seems like, for the PSWs to be with their care, and I think that they probably represent, and I think you said it right from the beginning, is that over 80% of time that the residents spend is with a personal support worker. And that's just the way it is, and therefore I think we need to pay a great deal of attention to that fact. So anyway, I appreciate
Absolutely.
I appreciate what you are saying. That family councils are very much aware that staff come and go for personal and health reasons. During this pandemic, and I think you alluded to it, there has been more than usual PSWs leaving the field. Would you say that is a direct result of the COVID-19, or is that a trend that's been happening?
Actually, this is a trend that we have been documenting since 2017 is when we really started seeing the mass decline of personal support worker students enrolled and also personal support workers leaving the field. When they leave the field, people think they're going to upgrade their schooling, and some do, but the majority actually leave the field to go work in factories or work at Tim Hortons. I have a Tim Hortons by my house that is literally staffed by all personal support workers because they just didn't want to do the job anymore. Let's just be honest. Being a PSW is not an easy job. No matter where you work, it is not an easy job. And when you compile no respect, no formal recognition on top of that, no full-time gigs, not a good minimum wage for the most part for PSWs, why would you stay? I'm saying this as a PSW who worked in the field for, a decade. and I left to do this. But I still be in the field, mind you, now if I wasn't doing this. But I can totally understand why they'd leave. And let me tell you something, it breaks their hearts when they leave their jobs. Not because of, their maybe sometimes their colleagues or their administrators or their DOCs, but because of the residents. That's why they stay. But then we have to treat them better and give them more so that they're not falling apart while on the job.
Mm-hmm. Well, the last question, and then I'd like to give you a few minutes if we still have some time. What supports does your organization recommend putting in place to ensure that mental health of PSWs, especially in facilities where there are major outbreaks, what types of supports would you recommend putting in place?
I would honestly, we're dealing with this right now because a lot of facilities are reaching out to us asking for mental health supports for their staff. We have an ability at the association, as our director of education is also a trauma therapist. We lucked out on that one. And so she's been able to guide a lot of our members through this crisis and bring them out the other side, shall I say. I think that long-term care facilities need to have like a therapy-based option for all of their workers that they can utilize for free. I mean, let's be honest here. It's not an easy job, and even when it's non-COVID, you're still dealing with death, you're still dealing with trauma, and they need to provide that service for everyone who works in the long-term care homes so that they can maintain staff and keep morale up and help them if they need help.
Oh, very interesting and very important. Very important. I'd like to give you a few minutes if there's anything that we haven't covered that you'd like to share with us. But before you do, to make sure we don't run out of time, I just want to say that it has been a great pleasure and honor to have had the opportunity to interview you today and to hear what your vision is for your membership going forward. I think that after hearing your responses, you would get a lot of support out there from the public, particularly from those of us who have had loved ones and currently have loved ones in long-term care homes. I think it's important that we able to regulate and also to make sure that we have ways of encouraging those who may not be suited for that job and to encourage them out of that hopefully profession, as it may be called down the road. But anyway, it's very important that we have the best possible people out there and giving them the best possible tools in order for them to do their job and to make it easier for them to have a more compassionate relationship with their residents as opposed to just doing the job. I think because of the time that they spend with those residents, it's important that they develop a little bit of a relationship with them, and only time will allow that. And they have to be given that time. And many of them would like to have that time. So anyway, please, if there's anything that you would like to bring up that we haven't discussed, the floor is yours.
Thank you.
You're welcome.
Again, thank you for being so patient with me in my basement today.
Well, we feel for you.
I just wanted to say that family councils are extremely important. Well, thank you. The family councils are very important, and I've worked with many different family councils across Ontario through my many years of working as a PSW and also being the president of this association. And your voices need to be heard in regards to regulation. The association has we're working with the Premier's office. We are trying to push it through. I'm going to be honest, we're really close, but it's between us and another option, and that other option is not going to do good for PSWs or frankly those in their care. So if your listeners, watchers want to reach out to us, please do www.opswa.ca. You can contact us. We're happy to send out our 2-pager on the regulation. We really believe that a lot of these issues in long-term care, to speak specifically to that, can be fixed by regulation. As it stands right now with personal support workers, we do not have a solid base to grow from. So everything that happens is a Band-Aid solution. We need to have a solid base to grow from so that we can, solidify these changes in long-term care homes for the frontline worker, the PSW. And So that's pretty much my spiel. But I do want to say too that people don't become PSWs for the money. They become PSWs because they love
Yeah,
what they do and they love the people they care for. So
I quite agree.
that's what I always like to say. And not just anybody can be a PSW. I think we've all witnessed that. It takes somebody
Mm-hmm.
truly special to do the job.
Right on, right on. Hopefully they'll catch your email address. It went a little fast. Maybe you'd like to slow it down so that people will have a chance to get it down on paper should they wish to contact you.
Absolutely. It's www.opswa.ca.
Great, great. Well, I think you're going to get a lot of responses because a lot of people are very, very interested in seeing changes. And so, I thank you so very much for your contribution today, and I wish you well, and I hope things get resolved at home. The floods can be challenging, so
Thank
I
you.
wish you all the best. And anyway,
Yes, they can.
you can contact me anytime.
Thank you.
You're welcome. Bye bye.
Thank you for listening to today's show. If you have any feedback on any episode or suggestions, please contact us on our social media on Twitter at Family Councils, on Facebook at Family Council Collaborative Alliance, and Instagram at FCCA0020. Thank you again for listening.